So my name's Alex Novak. I'm a consultant in emergency medicine and ambulatory care at Oxford University Hospitals, and I'm the research lead for the emergency department. And in terms of NCIMI, I'm the chief investigator for the GE Critical Care Suite project. The NCME is the National Consortium of Intelligent Medical Imaging, which is an organisation that tries to bring together a whole host of stakeholders around the development of AI imaging. So clinicians, researchers, industry stakeholders, patient groups, and tries to bring them all together, all these voices into the mix to try and accelerate the innovation pipeline for AI imaging from bench to bedside, essentially from conception into clinical practice. So this is one of the main projects that we're working on at the moment, and I'm chief investigator of this project. It's based around chest X-rays and in sort of two key areas, I guess. One is image quality control, so trying to make sure that you capture the best image you can when we're taking a chest X-ray, and also in assisting the detection of various sort of pathologies, so helping radiographers and clinicians to do that. The particular area of focus in terms of pathology is pneumothoraces, so punctured lungs on chest X-rays, and that's been the big focus and a big interest from me as an acute clinician, because this is something that we're routinely asked to try and detect on the chest X-ray, and so this has formed perhaps our main area of interest at the moment. Yeah, absolutely. So the market evaluation took place over about 3 months from October last year, and we captured around 2,500 images. And this was the first time, I think, in OUH we'd really had something like an AI algorithm sort of embedded in acute clinical practice. And this was particularly based around the ICU and cardiothoracic wards, where often imaging is taken and we don't get an immediate radiologist report. And this was sort of used by radiographers. Essentially the critical care suite alerts you when it thinks there's a probability of a pneumothorax, and flags the reader to have a look at the image, and we'll give you an overlay describing where it think it may be. And then obviously the clinical decision rests with the radiographer and with the clinicians themselves to act on it. But the idea is that should help speed up the workflow. Yeah, so I mean, there was a number of clinical stakeholders, because like most of these things, actually it's relevant to a whole host of clinical specialties. So there was radiographers, radiologists, ICU, cardiothoracics, and ED doctors like myself, all engaged in the project. We conducted a small sort of informal reader study, I guess, just to compare against some of the senior clinicians. I'm still annoyed that it beat me on one of the images. But yeah, broadly speaking, it was a good chance for us to get engaged with, not just the product itself, but actually sort of AI imaging in a broader sense. First time a lot of us have really encountered an AI imaging algorithm in clinical practice. So I mean, AI imaging technology, it has a huge potential, and I think a lot of clinicians in a lot of different specialties are very, very excited about the prospect of having sort of AI-assisted imaging in their practice. And I suppose there's two key ways, I'd say, where it can have a big impact, and one is improving our current practices, so enhancing our abilities to detect what we know we're already looking for. So whether it's a pneumothorax or it's air under the diaphragm, which can indicate a bowel perforation, or whether it's picking up cancer that perhaps we weren't necessarily looking for on an X-ray or CT. And the other way, of course, is actually just extending those capabilities a little further, and to think about perhaps imaging biomarkers that we hadn't really detected as being relevant for pathology. And the NCME actually has projects which cover both those aspects. I think there is a lack of familiarity at the moment in terms of where these may lay in the wider clinical teams. There's lots of excitement, but you have to think carefully about where the actual sort of use cases are and what's going to make a difference. I think there is perhaps sometimes a misconception amongst radiologists and radiographers that this is in some way going to sort of replace clinicians, and I don't think that's certainly not the case. If anything, it's the opposite. AI is about a synergy between clinicians and the algorithms and the imaging. I think in terms of barriers, the other thing is the hardware, making sure that the right level of tech is in place to cope with the sort of the large sort of data flows that are needed to do this. And I guess in terms of other barriers is making sure that all these systems are able to talk to each other as well. I suppose there's potential that there could be a lot of fragmentation if you have lots of different competing AI algorithms. So there's I think one of the longer term barriers might be trying to make sure that these have a shared language and a shared set of values, and I guess a shared set of metrics for performance. And this will all develop over time, I think, over the next few years or so. I'm always amazed at the rate at which this has developed, and I think one of the exciting things about AI has been that it feels as though the pipeline is a lot shorter to getting a usable product and a usable piece of tech actually into the shop floor. And of course, a lot of the systems, the sort of delivery systems, are virtually there already. We already use PACS in most places. So X-ray is pretty much universally done using digitized images. So I think that I hope that the pipeline is fairly short to this. And really within a few years, we could start to see these kind of algorithms being deployed, maybe, 4 or 5 years perhaps, once sort of regulatory approvals are through. There's a space for this in clinical practice already. We have something called the red dot, which in the UK, which is traditionally when you used to print out an X-ray, you put a red sticker on it and it was called the red dot, and that was if the radiographer or whoever had taken the X-ray suspected there was an abnormality on it. And where AI fits in is effectively as a kind of intelligent red dot, an automatic red dot. And so there's already space in the clinical practice and the clinical behaviours to respond to these kind of triggers. So next for NCIMI, and in the short term, we're just finishing our plans for the reader study for the critical care suite. And this is where we're going to take the algorithm and see how it improves the performance of clinicians, not just a sort of senior level, but right across the level in about 6 different specialties. So from consultant, middle grade to juniors, which of course is who is actually reporting these X-rays on the shop floor. So it's also important not to just focus on the activities of consultant ED clinicians and consultant radiologists who are always going to do really well against the algorithm. We want people sort of earlier stage that are going to be working in the middle of the night in a busy department and see how that, see what the impact the algorithm can potentially have on their ability to pick up pneumothoraces. And we hope to complete that, I think, by spring next year. So we're excited about that, and that's going to run across the Thames Valley, so across 5 different hospitals, with all the various sort of stakeholders of the NCME. I think what's exciting about it is it's like potentially a really powerful way of enhancing the performance of clinicians, and ultimately that should translate into better patient care. And all of this eventually boils down to what's going to be better for patients, and the sense is that by increasing not just the sort of acceleration of these particular products or particular algorithms, but actually the scope for creating an environment where it's possible to really accelerate the innovation and development in this area as a whole. So it's not just about the products that are in existence, but it's about the scope for how many more can do. But I kind of feel that we're at the tip of the iceberg here, really. And that's what's really exciting to somebody like myself as a sort of clinician researcher, to be at that interface of all these sort of stakeholders with all the, and I think that the thing about NCIMI that's exciting is that it brings all those key aspects together. So you've got the patient groups, you've got industry players, you've got the researchers and the academic background and the clinical spheres all coming together to really define the questions and to really sort of set out the scope of where AI imaging could go over the next 10 years.